everybody, it's Jim from Senior Social Squad. This is episode 2 of my journey through prostate cancer. The reason I'm doing this video is, number one, if you're going through something like this, it kind of will give you somebody to relate to in the situation I'm going through. But also, it's informational. Things have really changed in terms of prostate cancer treatment and detection, as we'll see in some of these procedures that I'm going through. It's not like the old days when they take you to the hospital and chop and no prostate.
Chop.
There's a lot of different options and a lot of treatments to spare the prostate and have you continue with a pretty normal life. So anyway, that's what we're talking about. Kind of to review how we got to this point is, in the last video, I had an MRI. My PSA had gotten very high, and the doctor decided an MRI was needed in order to detect if there was any cancerous tumors in my prostate. And it did happen that there were some tumors that were very, very, very suspicious in terms of being cancerous. What they're going to do in this particular test set that I'm talking about today is they're going to use that MRI, which is very, very detailed and very, very accurate, and use that as a guide to go in and use an ultrasound to kind of overlay that and do needle biopsies specifically of those tumors. That's something, again, that's changed. That procedure is much more exacting than it was. Back in the day, they used to go up a person's rectum, do some biopsies of just the prostate in general, and hope for the best. This procedure actually gets specific samples of the questionable tumors. I have to say that I suffered a bit of trepidation about this procedure because, generally speaking, I think I speak for a lot of guys, and that part of our body is usually kind of closed for business. We don't like people poking and prodding around there.
Jay, I'm not sure I like where this is headed.
And I'm no stranger to surgery. I've had several eye surgeries, that I had to be awake for and stuff like that. So, and I don't remember having that much trepidation about those procedures. There is a local anesthetic for this, and which helps a lot. But my doctor insisted it's not covered by insurance, but he insisted on using nitrous gas, which I had to pay out of pocket. And I'm telling you, it was the best money I ever spent in my life, because the nitrous kind of makes it, all this stuff's going on, you don't really care what's going on. And it was not very painful at all. I would describe it as 4 out of 10 in terms of discomfort, maybe 5 out of 10. So it really was not a bad procedure. All that worry that I had about it was unfounded. It took about an hour. I think the procedure itself took 20 or 25 minutes. But the getting ready and tearing down and stuff. And after for the next 12 hours or so, you have to wear a pad because you do bleed through your penis and a little bit through the place where the needle went into your perineum. It's not exactly a day at the park, but it is not really that bad of a procedure. And what's best is now that goes to a pathologist, and a pathologist is going to score those samples in terms of the severity of the tumors, and that's going to help determine a lot of the treatment that I'll be having going forward. So that's where I am right now. I hope this video was helpful, and I will see you when I get the results.